Well, hey everybody, this is Dr. Bulow with Revive Upper Cervical, and I wanted to take a minute and talk to you about chronic diseases and the idea of momentum. So this video is really for folks that have been suffering for a long time. If you have a disorder or a diagnosis that you've been struggling with for a while, and you're really trying to, figure this thing out, this video is a starting place for folks in that position. And maybe you actually don't have a chronic disorder, but maybe you know somebody who's been struggling for a while. Please share this video. You can even just share it because you never know. You never know who you might be connected with on Facebook or wherever that may have one of these just chronic issues they've been dealing with for quite some time. And this video is really a starting place, one of many starting places for people that have been dealing with issues for a long time that are really trying to get better. You know what I mean? They're really tired of being where they've been for a long time. And it's this idea of momentum. So here's the idea of momentum. The idea is that for most diagnoses and most issues, they did not occur yesterday, right? It typically is something that festers over time in the body. So as an example, we might start off with a bit of acid reflux, and it eventually turns into irritable bowel syndrome, and then eventually turns into diverticulitis, and then it turns into ulcerative colitis, and you can see how it snowballs over years and decades. Or, for example, someone who has a bit of neck pain and shoulder pain turns into headache, turns into chronic fatigue, turns into fibromyalgia. See how that kind of can build over time? And so most folks don't just wake up one day on 10 different medications and have 5 different diagnoses. It's something that builds over time. Well, in the same way, restoring your health and your life and your quality of life is also something that takes time. If someone was obese today and they started eating right for dinner tonight or today, chances are they're not going to wake up tomorrow and be 50 pounds less. It's just not the way it works. And so we just have to realize that these disorders and diseases that we have culturally, diabetes, digestive issues, autoimmunities, cancers even, and I don't mean this disrespectfully. I'm not saying we have the cure to disease or anything like that, but I'm just saying that sometimes, yes, genetics, but a lot of this is a lot of lifestyle, a lot of accidents and injuries, a lot of lifestyle built up over time leads to where we are. We are today where we were. We are the result today of the result of many days and weeks and months and years before us. And where we want to go might be days and weeks and months and years away. But as long as we can recognize that, then we can have the patience to go through the steps that are really necessary to make actual lasting long-term change. It's just the way the body works. It's a matter of momentum. We're either building health and vitality and wellness, or we're growing diseases. It's health. And by the way, health is not a passive thing. Usually, to build health, it's an active thing, a very purposeful thing. So just some thoughts for you. I just thought it was important. I had some conversations today with some patients about that, and I thought I would share it, and hopefully it brought you some value. So thanks for joining me. If you guys have any questions at all regarding any of these things, just let me know. We'll be happy to look into it for you. We'll talk to you next time. Bye now.